Okay, hello everyone. My name is Aiden Vaughn, and today I'll be introducing our group's paper review. The paper we chose is called Artificial Intelligence: Enabled Electrocardiograms for Identification of Patients with Low Ejection Fraction. This is a pragmatic, randomized clinical trial published by Yao and colleagues in 2021 in Nature Medicine. My part of the presentation will cover the introduction to the study and why this research matters and what the question the authors were asking, as well as the assays and the methods they used to test it. So to start with the problem, the heart's pumping strength is measured by something that we call ejection fraction or EF. If the EF is low, the heart is weak and the patients are much more likely to develop heart failure or even die early. The tricky part is that many people with low EF don't feel sick at first, so the problem often goes unnoticed. This matters because doctors can measure EF with echocardiograms, which are basically ultrasound scans of your heart. These tests are very expensive and time consuming, so they aren't used for routine screening. On the other hand, ECGs, the stickers and wires tests you've probably seen in hospitals, are fast, cheap, and already done for patients all the time. So, really, the new idea is that researchers developed an artificial intelligence program that can analyze EKGs and spot hidden patterns linked to low ejection fraction. It looks promising in earlier studies, but the big question here was, would it actually help doctors catch more cases in real-world clinics? So, the question asked in this paper was whether using AI analysis of EKGs in routine care would help doctors diagnose low ejection fraction more often than usual care. The researchers' hypothesis was that AI-enabled EKGs would lead to more new diagnoses within 90 days, especially in patients who might otherwise be missed. To test this, the researchers ran a clinical trial at 45 Mayo Clinic primary practices across Minnesota and Wisconsin. Instead of randomizing individual patients, they randomized entire care teams, groups of doctors, practitioners, and physician assistants. This way, they could see how the tool worked in real world practice. Every time a patient got an EKG as part of a routine care, the AI program analyzed it. If the AI thought that the patient was at risk for low EF, the report popped up in the electronic medical record with a message that told the physician, NP, or PA with considering ordering an echocardiogram. If the AI result was negative, it said no extra testing was needed unless symptoms suggested otherwise. Clinicians in the control group just practiced as usual and didn't see the AI's results. They really wanted to measure the main thing of patients who got a new diagnosis of low EF within 90 days of their EKG. They also tracked whether patients went on to get echocardiograms and whether they were started on standard heart failure medications. In short, they wanted to know, did the AI help find more cases and did it change what doctors did next? And now I'll pass it on to Charles.
Hello, I'm Charles Parker, and I will be talking about the results for AI-enabled ECGs for detecting heart weakness. To begin, we'll be looking at the diagnostic rates, but to start, I want to talk about the trial including over 22,000 patients without prior heart failure. About half were in the AI group, while the other half was in the usual care group, which was just patients seeing doctors. What they found was in the AI group, 2.1% of patients were newly diagnosed with low EF, while in the control group, where patients only see doctors, only 1.6% were diagnosed. This seems like a small difference, but it is still meaningful because AI had about a 30% higher chance of diagnosis compared to doctors seeing patients by themselves. For patients with that was flagged as high risk, the AI group was able to diagnose 19.5% compared to doctors only diagnosing 14.5%. To move past the percentages, the AI group was able to diagnose every 1 in 5 patients, while the control group was only able to diagnose 1 in 7 patients. So this shows that AI was most useful for spotting patients who were in the most danger. Now, thinking about follow-up care, Overall, both groups were pretty similar in receiving follow-up care, around 18 to 19%. But among those with positive AI results, echocardiograms were ordered much more often in the AI group. So thinking about the numbers, AI allowed half of patients to get follow-up scans compared to only a third by doctors seeing patients by themselves. And once patients were diagnosed, around 7 out of 10 were started on important heart medications. Almost all of the sickest patients ended up on treatment, which is the best outcome we could hope for with these results.
Hi, I am Alyssa. So I'm gonna talk about the interpretation part. So what do those results really means? The researchers found that using an AI tool with regular heart tests, those simple ECGs most people have had, helped doctors find weak hearts earlier. In the group where doctor could see the AI results, more patients were diagnosed with low ejection fraction compared to the group with usual care. The effect was even stronger in patients the AI flagged as high risk. Now here's an important point. The AI didn't just cause a flood of extra testing. Overall, the number of heart ultrasounds called echocardiogram was about the same in both groups. But in the patients the AI flagged, doctors was much more likely to order that the follow-up test. That shows that tools help direct attention to the right patients instead of overwhelming the system with unnecessary exams. The author interprets this as a proof that AI can help catch heart's problem earlier and more selectively. We agree with them. The data shows a consistent increase in new diagnoses, especially for those the AI identified. At the same time, we should be cautious. The overall increase in new diagnoses was still fairly small, and the study didn't measure long-term outcome like hospitalization or survival. So while the AI looks promising, we don't yet know if finding these extra cases earlier will actually change the patient's lives in the longer run. So, in short, the tool seems to work as intended. It helps doctors spot hidden heart problems without adding unnecessary works. But the next step will be to see whether the earlier detection really improves the health outcome for patients over time. Say about that yet.
So, what does this study mean moving forward? We know that AI and echocardiograms together can lead to earlier diagnoses and for weak heart function. And this is a powerful first step. But researchers need to see how AI can help, if AI is going to help um, with the better survival outcome and lead to better life expectancies. But we also need to see what the cost benefits are of this and the cost effectiveness. So is it going to be allowing people to not have those long-term hospital stays in the future? So that's kind of what this money is showing. The stethoscope was the diagnosis, and the heart was better survival and outcomes. Then we also need to see if this will be beneficial in underserved and rural communities, which is what the globe represents. And if AI, like in this case, in echocardiograms, can be used in other types of diagnoses, such as for like liver diseases and things like that. So, what's the big picture and why does it matter? Heart failure is one of the leading causes of death globally, and early detection would allow us to have physicians treat the patients sooner and sooner. AI also shows promise in everyday healthcare by being able to be used in other types of diagnoses and treatment like ways. So, closing, thank you for listening. And if you have any questions, please be sure to reach out.